The whole chapter of the Institute of Chartered Accountant Ghana is calling for inclusion of a chief who doubles as a traditional birth attendant onto the district assembly training programs for health workers and to put him on a modest payroll. The calls are echoed by a WhatsApp group, Paddies, which together with the ICAG financed a baby delivery center for the village Mangotideke. Their efforts follow a JoyNews online documentary highlighting unsafe delivery processes there. They were speaking after the newly constructed center was handed over to the community. In this report, JoyNews' Gifty Andwapia focuses on what ought to be done to maintain the facility and posting of a nurse to assist the traditional leader. We've got a conversation on the back of this. Watch this.
And so, the singing and dancing continued into the night after the handing over ceremony of the Mangotideke Birthing Center. But there are outstanding issues, and the question is, what next for the center? The donors and some of the residents have some thoughts. But first, here is the initiator of the project, Dr. Divine Novieto, going through what there is and how they are expected to be used.
We have the office where the traditional birth attendant and the nurse will receive the guests and also the patients into the facility, where they also keep the records. From that place, we go to the delivery room. In the delivery room, we have a delivery bed that will be used for the delivery process. So it's a bed that we have acquired for that particular purpose. So it's in there. In that particular delivery room, we also have the toilet and bath complete for the expectant mother to use. In case of the need for it, then the expectant mother will use that particular one there. And then we also have a wash and basin inside. That will be used for cleaning and washing of items inside the delivery room. After that, we have the recovery room, where the nursing mother will recover after the birthing session. So that one we have the recovery bed in there and also the cabinet for them to store items in there. We have the general store and also the general WC. And then after that, we have a digester system that we use to process the waste that will be generated in the building. So, and then there's a porch where visitors can also sit and then wait for their patients.
The community self-help ignited for him during this project, he says, must be kept up to keep this community going.
I think that we also need to commend the local community because they decided to declare Thursdays as communal labor days. So we plan, and on Thursdays we come, they work with us together, and then we try to work on that particular Thursday.
With the handing over done, expectations are also high on both the village midwife and the nurse about to be posted here, as well as the district assembly. Institute of Chartered Accountants Ghana, one of the donors, is urging the Agotimeziope district assembly to allocate funds for the maintenance of the birthing center donated to the village. Chairman of the organization, Kennedy Komlade, is also asking for inclusion of the chief, who also serves as a midwife in the village, on the district assembly's training programs for health workers.
I appeal actually to the DC to ensure that every year he makes some budgetary allocations towards the maintenance of the place. I also appeal to the district health directorate to include the traditional birth attendant, Togbi Bo Moses, in their refresher training programs. I understand that he's been doing this work for well over 20 years, but he still needs some skills. So it will be important for him to also get some training in new ways of handling things like this. And also I appeal to the assembly also to ensure that Togbi is giving some pecuniary motivational package, money. So every month, what will it take for Togbi to be included on their payroll, to be giving something small to motivate him? I also appeal to Togbi to identify some dedicated, committed people in his community so he can train. So in the event that he's no more, we will be sure that the work that he started and continue to do will still continue.
For the Paddies group, which contributed most of the finances, it is about time social clubs, especially on social media, adopt a sense of purpose that benefits communities. They say this in addition to the urgent calls for a nurse to be posted immediately.
The traditional birthing attendant definitely needs help from the government and from the Ministry of Health to assist him in understanding some of the new, to partake actually in some of the refresher courses that come for their nurses, and also to train the next attendant to assist him. So we hope hope that they continue to do what they do in their traditional environment, but also build upon it to meet accepted health standards. Or use your social networks to do good, whether you're a member of Rotary Club, a member of Lions, a member of any WhatsApp platform. If there's an opportunity for you to do good, I suggest that you pull your resources together, pull the strength of your network, and actually impact your community in a positive way.
Well, the survival of this facility and its beneficial use lie in the hands of the people and the Assembly. District Chief Executive of Agotime Ziope, David Dixon Jokwe, sent a representative as he was said to be on an important mission in Accra. Here is the Agotime Area Council Chairman Seth Agbobli speaking for the DCE.
Yeah, well, the Assembly is going to take charge of this because it becomes a property of the Assembly. The Assembly is going to make sure the maintenance process goes on every year, and then we make sure that the facility also has to come with people who has to work. So the Chief Executive is aware of that, and is going to make sure everything goes well by making sure people are transferred or even released to come here and come and help the birth attendant here. As in the person has not yet been but the Chief Executive and the Health Director has already had plans far advanced to make sure a community health comes to assist the birth attendant, the traditional birth attendant here to be able to carry on the activities of this particular facility.
Well, the community has high hopes that this building will become a main hospital someday. Ahead of that day, they plan to share.
We need to bring villages around. There is from Pogaji, Akwete, Segbale, Safokope, all to come here and to deliver at the center. Because that's why it is not for Mangotideke alone, but it is for the areas around Mangotideke. We need two hotels for nurses who can stay there and be a helper to the community.
These women and children are so grateful. So, if you pass by Ho or Petwe, make sure you say hi to Mangotideke because you will not miss their signpost erected as part of this birthing center project, saying, inspired by JoyNews. Kiftiandopia, JoyNews, Mangotideke, Volta Region.
And this is certainly a story that puts a lot of smiles on our faces. Gifty Andropia, my colleague, did a really good follow-up after she first told the story back in 2013. And here we are, 2019, fast forward, and there is a facility for the community. Well, we still have to do more follow-ups as there are some challenges. No electricity. During the day, the facility can operate. There's also not a permanent health staff in the facility. In studio, I've got the immediate past president of Paddies Group, Guido Sopime. As you well know by now, they help put up this project. But joining us via phone is the DCE for Petoi, David Ijokpe. He joins us via phone. Good morning to you, sir. Thank you for your time.
It's my pleasure, madam. Thank you.
Yes, sir. So now that the facility is up, there are a few questions. Plans to get a permanent nurse into the facility. The community members did say that there was a health person who would come in once in a while, but now we're looking for a permanent health nurse to be in the facility. Are there any deadlines in terms of timelines to get the nurse in the facility going forward?
Yeah, madam, this is already in the pipeline and is known to the district health director. And periodically, I come down to site for her to see the progress of work going on there. And I believe with this commissioning of the place, he will quickly put in place a recognized nurse to come and assist the old man to get the place running scientifically. Okay,
so are we working with any timelines here since the facility is operational?
With this commissioning, I'm not going to intensify it should be before January because the place is in readiness. So, but I'm not going to liaise with her to get that thing done quickly.
Okay. There's also the issue about the fact that the place is operational in daylight, but there's the need to extend electricity to the community.
Yeah. the electricity is there already. We only intensify it with the appropriate phases that will enhance the delivery and all that.
Okay, so what are the specific plans towards that?
Well, we will. I'm sure it's already in our budget, so it will just be pushed across quickly.
Okay, so can I firmly say that this would be done also before January next year?
Definitely.
Okay.
It's very, very important.
All right. I'd like to say thank you. I just wanted to run by you these two, questions now that the facility is up. So thank you so much for your time. That's District Chief Executive for Petoi joining us for answers to those specific questions. But Guido is here. Congratulations. Thank you for doing it. This was a social cause, really. So maybe I can ask what touched you? What was it about Mangotideke with this particular project that you wanted to support?
Okay, maybe I may start with who Paddies are. Yeah, Paddies is a group of friends. It started as a WhatsApp group, about 10 people. And then with time, we started adding on members. And it was mainly a fun platform where we shared ideas and information. But later on, we realized that we came from different backgrounds, different professions, different religions, different political groupings. But we were able to come together as a group to socialize and have fun. So the idea came that of what use would we be to the society if we are only just having fun here in Accra? We must touch lives. So that's when we then brought in the idea of touching lives as part of our activities. And we've been in existence for the past 6 years.
Okay.
And we've been in, charity has been one of our major activities, and we've touched a lot of communities. Lot of communities. We've done more than 10 projects in the past.
Interesting.
And Mangotideke came in handy. We focus our activities mainly on health and education.
Okay.
And sanitation. We've done a couple of activities in a community called Edukrum. We've done something in Adan. We've done something with the World Bank, USAID, and all over.
Okay.
So when we were approached, first of all, we saw the TV documentary about the traditional ruler being a birth attendant and all that. We were really touched. And when we were approached by the project initiator, one Dr. Divine, we saw that this is one of the staff who definitely want to jump on. So we jumped onto it.
Well, thank you. Now we're here and it's completed and it's done. One of the questions we are asking and we continue to ask is how they intend to maintain the facility. It's just asking the DC about a permanent nurse and how to get the electricity to the place. So would you be interested in following up? Would you be looking at it?
Definitely, because as I indicated, these are contributions from members of this group. It's our own personal contributions. And then even though we raise funds, we appeal to other well-meaning people to come to our aid. These are monies individuals have dipped their pockets and given us to go support community. And we will definitely want to ensure that this edifice is not just there for photo taking, but it is there touching lives and it is working as we expect it to be.
Fantastic.
So we will expect the DC, we've heard him, we thank him for the assurance, but he must know that Paddies will be following up. And we want to ensure that this place becomes something that other groups will look up to and will want to emulate. Well,
we thank you for coming on board because we wouldn't, if you tell the story and it ends there, you haven't really achieved much. I think the joy is getting people on board and coming to this end that we see today. So thank you, and thank you for your members as well.
No problem.
Yeah, and that's Guido Sopime. He's immediate past president, Paddies Group. They help support with this community health center at Mangotideke. I'm also excited about the signpost that they added to the structure. For the first time, they do have a signpost. Thanks to my colleague Gifty Andawapia, who first told the story and did all the follow-ups, and now we're here.